Hi everybody, I'm Dr. Jon LaPook. Welcome to CBSDoc.com. Sooner or later, most of us are faced with a difficult decision, which is we have a loved one who no longer can stay at home. What do you do? Where do you go? I'm here with an expert in this, a physician who's a geriatrician, and he's the medical director of Daughters of Israel in West Orange, New Jersey. Dr. Joshua Schor, welcome.
Thank you.
He has written a book called The Nursing Home Guide, right? A doctor reveals what you need to know about long-term care. Let's start at the very beginning. How do you know when a loved one can no longer stay at home?
A lot of it comes down to safety. There's certain situations where someone who's aged has developed a number of issues and problems.
What are specific things that kids and loved ones should look for?
Right. I think if someone is falling, that's one issue that can often get people in the hospital, much less in a nursing home. There are other things like managing their medications by themselves. I mean, it's very critical that they be on a certain regimen of medications to keep their congestive heart failure under control, or seizures, or what have you.
And what about mental status problems, like leaving the gas on, things like that?
I guess everyone's entitled once to leave the gas on. I mean, people do that. But if it happens twice, or there's some real danger, or there's been a fire, or smoking in bed, or things like that, that's again another safety concern that would really prompt someone for a more general evaluation. Now, sometimes a geriatric care manager can come in and evaluate the situation.
Geriatric care manager.
Right.
We're going to try to define these terms. All right.
Right.
Now, people are out there saying, what the heck is that, and where do I find one?
Right. Care manager is sort of this wonderful combination of a professional nurse or social worker melded into being a family member. And it may be a situation where they just need a once or twice evaluation. There are others who really check in 3, 4, 5 times a week, sometimes every day.
Now, and I'll do a little mea culpa here, right? I'm an internist and a gastroenterologist, but I take care of people from head to toe. And yet, sometimes there needs to be more expertise, right? Like, it's called a geriatrician, right?
A geriatrician is really someone who either comes from internal medicine, who has done already a training period in internal medicine, or family medicine, and is able to kind of be an expert in those things that tend to fall through the cracks. And they're also trained in a very, what we call, interdisciplinary way. So they train with social workers and nurses and physical therapists.
So let's now move on to the next stage, which is we want to go somewhere. Where?
So you always look for the least restrictive kind of place where you would have more freedom. Again, balancing out what are the safety issues and what level of care that you need. If you really need professional nursing care, that is, you might have a wound or frequent falls or medication that requires very close monitoring, it may be that you need to lean more to the skilled nursing or nursing home side of things.
Okay.
But maybe you need some reminders, or you need help showering in the morning and laying out your clothes, something very simple. So maybe a half hour, an hour of someone helping you in the morning would be enough. And that can be found either in a senior living facility or an assisted living. There are also these naturally occurring retirement communities. They're called NORCs, N-O-R-Cs. Tend to occur more in the suburbs, or actually not. They can be in urban areas as well. But these are places where a community has decided, either through some faith-based group or other groups, that they are going to invest in an infrastructure to help people stay at home.
Let's say now you go into a nursing home. That's really the most skilled facility, right, where you really need some advanced care. What more can I do as the son who is looking for the nursing home for a parent?
Talk to physicians in the community who might be in the know. A lot of times the discharge planners from the hospital will have a good sense of what the better homes or what the issues are.
That's a good clue.
Yes, so
call the hospital social worker.
You could do that. Sometimes they'll kind of play it professional, they won't give you the lowdown. But a lot of times they'll take you to their confidence, especially if you're coming out of the hospital. But aside from that, the main thing to do is to go in and make an appointment and get a tour. And I really strongly suggest doing it with your siblings, if there are siblings involved, so everyone hears the same amount of information in the same way.
Any other things that people should be looking for as you're going on that tour?
I think they should go in the morning for sure. That's when the place should really be alive. I mean, nursing homes aren't thought as these sort of rockin' and rollin' places, but there should be a lot of activity, should be a lot of energy. The activity should be going on. You don't want to see a lot of TVs on. That means they're kind of parking people in front of the TVs. If you witness a meal, I think it's important to see what that interaction is like between the kitchen people, the servers, and the residents. You want to see that it's respectful, that they actually bend over and talk to the person one-on-one. One of the big issues that the government has had with nursing homes for years, which has prompted these surveys and whatnot, is that they felt that the nursing homes didn't really consider the residents as individual human beings. And I think when you make your personal tour, that should be your kind of mantra. Are they treating them with respect and as individuals?
Now, we go down to the, not the skilled nursing, but to assisted living facilities, various other forms of those. I assume it's the same kind of criteria?
I think it's not quite as transparent. They aren't surveyed in the same way. There aren't as many regulations, but in the facility, in the assisted living facilities, they have to have some hours a day or some shift a day, but that means that at many shifts there really is no nursing care at all. Or there'll be what they call med techs or medication technicians, which will help remind someone to take a medication, but they can't actually place it in their mouth and help them do it.
Okay.
So there's a lot of gradations. Now, most assisted livings have become very savvy, and they know that they would rather have their people remain with them for the rest of their lives. So what we call aging in place. And to do that, they need to sort of provide more services to them. So some assisted livings almost verge on being nursing homes in the sense that you can buy an extra hour, 2 hours, or 3 hours of care a day.
But now let's say we've made the decision, person cannot stay at home anymore, and you need to get them somewhere. Now, first point is, if they agree, they're willing to go, then that's one thing. What if they're not willing to go?
Well, that's very tough. That's very tough. Often what we suggest is getting all the family members together. Sometimes a parent can tend to blame the one child who's either closer or seems to be the one kind of agitating for this change. And it can get to be very personal, and there are all kinds of other issues that can come up. So what I really tell people is to get brothers, sisters, siblings, parents all together when you have a plan. And often a care manager can really help.
Now, what about cost?
Cost is tough. I'd say right now, if you are lucky enough, in a sense, to be coming out of a hospital and on the road to going home, Medicare actually picks up the cost of that subacute care.
For how long?
For 20 days, they will pay, I think, 100% of it. There might be a deductible for the
after that?
After that, from day 20 to 100, it's 80%. But many people have these Medigap policies that will fill in.
And
if they're on Medicaid, it's after the 100, they're really on their own.
You're on your own.
Yeah, and then it gets to be very expensive.
Can that be?
Well, nursing homes can average anywhere between $300 and $400 a day.
A day,
right? So it's a lot to think about.
What are some of the big misconceptions that people have about this entire field?
I think one of the main ones is, again, all that glitters is not gold. To go into a home and sort of have your socks knocked off by a chandelier or what looks like a great lobby, and when you scratch the surface a little bit and meet the staff, it's not really what it's cracked up to be. So I think that it's very important to sort of get the word out on the street.
You're talking to America, and you can give some advice about this. What would it be, the top advice?
If you end up needing a nursing home for someone, find a home that you're just viscerally comfortable with, that you've sat in the lobby, you really like and value the interactions. You've seen something that's really kind of touched your heart about the way an aide spoke to a resident of a nursing home. I've seen some beautiful sites that I will never, forget in my life. And when it really does feel like a home or a family, that should speak to you.
Well, thank you so much,
Okay,
Dr. Joshua Schor. Thank you for joining us for another episode of CBSDoc.com. I'm Dr. Jon LaPook. Good day and good health.